Oh, hi there. Welcome to our video, The Basics of Infection Prevention. Okay, we know you're busy and you have a lot of important things to do, but hear me out. This video is going to provide some life-saving information that can help keep you and your patients safe. I mean, think about it. You got into this business because you want to help people, right? This is your passion. This video is going to teach you about things you can do to help you do your job better and safer. It's chock full of information and tidbits to help explain not only how we do things, but why we do them that way to begin with. Hey, it's full of things even I didn't know. Oh, and this is my partner. He's going to give me a hand explaining some of the more difficult concepts. We promise we will keep it as short as we can, make it a little entertaining for you to watch, and get you on your way as quickly as possible. Hopefully, we'll all be a little bit wiser than when we started. Ready? Let's go. Really? That's what SPICE stands for? Huh. See? We learned something new already. Now let's get started. Healthcare-associated infections are a major yet often preventable threat to patient safety.
Healthcare-associated infections are also referred to as HAIs.
They are indeed. Hey, now I know we just got started, but maybe we should pause here for a second and let you know that there will be a lot of acronyms tossed out during this program. And yes, we know they can be convoluted and confusing, but it's important that you know what we mean when we use them.
So every time we use an acronym, they'll appear on screen as a nifty little reminder of what they are. Go ahead, try it.
Healthcare-associated infections. Huh. Now, let's see, where were we? Oh yeah, healthcare-associated infections are a major yet often preventable threat to patient safety. Each day, approximately 1 in 31 U.S. patients contracts at least one infection in association with his or her healthcare, underscoring the need for improved infection control in U.S. healthcare facilities.
1 in 31 seems like a small number, but when you consider the millions of people who are admitted to or receive care in a healthcare facility, it adds up quickly.
Okay, I'm going to have to throw up a chart now, and we don't have room for you. Here's a progress report showing the decrease in 5 major infections transmitted in healthcare facilities. Now, I'm not going to go into every number here, but as you can see, between 2015 and 2016, there was between a 6 and 11% decrease across a variety of infections.
So the efforts we put forth so far are starting to work, which is great news. Hey, where'd we go? Are we dead?
No worries. With the magic of video, we can will ourselves back into existence. Ah, there we are. Okay, so as you can see by this chart, the numbers for North Carolina are a bit more mixed. We're not going to go over this in too much detail because we promised to keep it short.
But we've set up a website that you can access if you're the type of person who likes to dive into these kinds of details. Many of the charts and graphs, reports, and studies we refer to will be on that website. We'll put up this graphic as a reminder that you can visit it anytime and look up the details to your heart's content if that's your thing.
Research like this shows that when healthcare facilities, care teams, and individual doctors and nurses are aware of infection problems and take specific steps to prevent them, rates of some targeted HAIs can decrease by more than 70%.
Great. Well, our job here's done. Thanks for watching.
Whoa, whoa, whoa there, partner. Just slow your roll. We're just getting started. You see, despite this kind of progress, more action is needed at every level of healthcare to eliminate infections that commonly threaten patients and to reach the new U.S. Health and Human Services targets. More steps can and should be taken to control and prevent HAIs in a variety of settings.
Who are all these people?
These are residents from long-term care facilities, such as nursing homes, that are transferred to hospitals every year. It's estimated there are up to 200,000 residents transferred and admitted to the hospital per year at an estimated cost of up to $2 billion annually. As if the costs weren't bad enough, when a nursing home resident is hospitalized with a primary diagnosis of infection, the death rate can reach as high as 40%, and that's not what we want. implementation of standard precautions constitutes the primary strategy for prevention of healthcare-associated transmission of infectious agents among patients and healthcare personnel. Now, standard precautions consist of multiple strategies to reduce the risk of transmission of infection. However, for our purposes today, we are going to focus on two major components: personal protective equipment
And hand hygiene.
That's right. Good old-fashioned hand hygiene is the cornerstone of standard precautions. But it can be more than just washing your hands with soap and water. It also includes antiseptic hand wash, an alcohol-based hand rub, and surgical antisepsis.
Man, that's a lot of hand washing.
Hand hygiene. We touch everything with our hands, from our phones to doorknobs to medical supplies. Germs can be transmitted from surface to surface. Now, this seems obvious to us today, but it wasn't always that way.
A long time ago, people had no idea that germs caused infections. Hand washing wasn't really their thing, even for surgeons. In 1847, Ignaz Semmelweis noticed dramatically different mortality rates in 2 maternity clinics in a hospital in Vienna, Austria. The first clinic, which utilized medical students, had a mortality rate of 10%. While the second clinic, which utilized midwives, had a mortality rate of 4%. The medical students in the first clinic also performed autopsies. After determining that medical students were transmitting pathogens on their hands from the cadavers to the maternity patients, Semmelweis instituted a policy of using a solution of chlorinated lime for washing hands between autopsy work and the examination of patients. The mortality rate in the first clinic dropped 90%. Dr. Semmelweis is now known as the father of hand hygiene.
So beautiful.
Wow, so everyone must wash their perform hand hygiene these days, right? I mean, it totally makes sense.
You'd think so, but the truth is, we still have a way to go in the world of hand hygiene. So, how are we doing today? Well, some studies have shown healthcare personnel compliance with hand hygiene to average approximately 40%.
40%? What are you people doing?
Now, be nice. There's lots of reasons why people might not be practicing hand hygiene. It could be supplies aren't easily accessible, skin irritation. They might think using gloves might eliminate the need. They might be too busy and not even thinking about it. But the bottom line is, the better we get at performing hand hygiene, the HAI rate gets better. So it's really a no-brainer. Now, I know that when you get busy, you need to move quickly, and that can save lives. But good hand hygiene saves lives as well, and we can document its effectiveness. In fact, hand hygiene is the cornerstone of preventing HAIs, which is a major cause of illness and death in healthcare settings. So take a minute to think about that the next time you think you may be too busy for hand hygiene. Now it's time to get to the nuts and bolts of when hand hygiene should be performed and how to do it.
But the World Health Organization and the Centers for Disease Control and Prevention, CDC, have similar recommendations. The CDC's is much more detailed, and you can visit the website to check it out. You should always perform hand hygiene in the following circumstances: after touching blood, body fluids, secretions, excretions, or contaminated items; immediately after removing gloves, and between all patient contact and contact with the patient's environment.
When hands are visibly dirty or are visibly soiled with blood or other body fluids, like my partner's, wash hands with soap and water. If hands are not visibly soiled, like mine, use an alcohol-based hand rub. Some very nice people have already made some videos of the best way to perform hand hygiene using either soap and water or an alcohol-based hand rub. So we're just going to take a quick breather while you enjoy these. See you on the other side.
Here are the proper steps for hand washing. Wet hands with water. Apply enough soap to cover all hand surfaces. Start by rubbing hands palm to palm. Next, place your left hand over the back of your right hand and interlace your fingers. Repeat for the other hand. Then rub palm to palm with interlaced fingers. Rub the back of your fingers by bending and interlocking so the palm of each hand contacts the fingers of the other. Grasp each thumb and rotate within the opposite hand. Rotate the ends of your fingers in the opposite palm. Rinse with water. Dry thoroughly with a single-use towel. Use the towel to turn off the faucet. The entire hand-washing procedure should take 40 to 60 seconds. Here are the proper steps for hand rubbing. Apply a handful of product in a cupped hand and cover all surfaces. Start by rubbing hands palm to palm. Next, place your left hand over the back of your right hand and interlace your fingers. Repeat for the other hand. Then rub palm to palm with interlaced fingers. Rub the back of your fingers by bending and interlocking so the palm of each hand contacts the fingers of the other. Grasp each thumb and rotate within the opposite hand. Rotate the ends of your fingers in the opposite palm. The entire hand rubbing procedure should take 20 to 30 seconds.
Ugh, gets me every time. There's just a couple more things we thought of while we were waiting that you might need to know. Just, some tips and tricks that are helpful.
Do not wear artificial fingernails or extenders when having direct contact with patients of high risk.
Keep natural nail tips less than 1/4 inch long.
Wear gloves when contact with blood or other potentially infectious materials, mucous membranes, and non-intact skin could occur.
Remove gloves after caring for a patient. Do not wear the same pair of gloves for the care of more than one patient, and never wash gloves. And always change gloves during patient care if moving from a contaminated body site to a clean body site. The CDC has a few recommendations as well when dealing with your staff and employees. Involve staff in evaluation and selection of hand hygiene products. Provide employees with hand lotions and creams compatible with soap or ABHRs. Provide hand hygiene education to staff. Monitor staff adherence to recommended hand hygiene practices. Provide feedback to staff on compliance with recommended hand hygiene practice.
Are we done with hand hygiene then? What are our takeaways here?
Yes, let's break it down, as the kids say these days. Do kids still say that? Maybe? Perform hand hygiene exactly where you are delivering health care to patients, at point of care. During health care, there are 5 moments when it is essential to perform hand hygiene. The preferred method for hand hygiene in most clinical situations is use of an alcohol-based hand rub. If hands are visibly soiled, soap and water should be used. Perform hand hygiene using the appropriate technique and time duration. Wait, what are you doing?
That's it. Aren't we done?
Not quite yet, Grasshopper, because now we need to talk about PPE. PPE refers to a variety of barriers and respirators used alone or in combination to protect mucous membranes, airways, skin, and clothing from contact with infectious agents. Selection is based on the nature of the patient interaction and/or the likely modes of transmission. Types of PPE include gloves to protect hands, gowns to protect skin and/or clothing, masks to protect mouth or nose, and goggles to protect eyes. Or you can use face shields to protect face, mouth, eyes, and nose.
3 overriding principles related to personal protective equipment.
Wear PPE when the nature of the anticipated patient interaction indicates that contact with blood or body fluids may occur. Prevent contamination of clothing and skin during the process of removing PPE. Remove and discard PPE before leaving the patient's room or cubicle. For healthcare personnel safety and to prevent inadvertent contamination, always keep hands away from your face. Limit surfaces touched. Change PPE when torn or heavily contaminated. Always perform hand hygiene after removal of PPE. And work from clean to dirty. Now, what does work from clean to dirty mean exactly? Once PPE is donned and the staff contacts something that is dirty or contaminated, The PPE should be removed and proper hand hygiene used prior to donning clean PPE to perform a clean activity. We'll demonstrate here with gloves since that's the most common type of PPE used. See, my partner is helping the patient. He turns, touches a piece of equipment, and then he turns back to the patient and... Whoops! Big mistake. He was supposed to remove his gloves and use proper hand hygiene, put on clean gloves, and then go back to the patient. Let's try that again. Excellent. Let's move on to the types of PPE you will encounter during the workday.
As we mentioned, gloves are the most common type of PPE, and selection should be based on purpose, glove material, and use, sterile or non-sterile.
There are several do's and don'ts associated with every piece of PPE, including gloves. We flipped a coin, and I have do's and my partner here has don'ts.
We did? I don't remember.
Do: wear gloves when it can be reasonably anticipated that contact with blood or other potentially infectious materials, mucous membranes, or non-intact skin can occur.
Don't wear the same pair of gloves for the care of more than one patient.
Do: remove gloves after contact with a patient and/or the surrounding environment, including medical equipment.
Don't wash gloves for the purpose of reuse, since this practice has been associated with transmission of pathogens.
Do: change gloves during patient care if the hands will move from a contaminated body site, such as the perineal area, to a clean body site. Now let's talk about gowns. No, not those kind of gowns. But thanks. Factors to consider when selecting a gown include purpose. Why are you wearing the gown? Material of the gown, degree or fluid resistance, for example. Be sure to wear a gown that is appropriate to the task and protects skin and prevents soiling or contamination of clothing.
Wear a gown for direct patient contact if the patient has uncontained secretions or excretions.
Remove gown and perform hand hygiene before leaving the patient's environment.
Do not reuse gowns, even for repeated contacts with the same patient.
Finally, we are going to talk about face protection PPE. No, not that either. Try again. There we go. Masks should fully cover nose and mouth and prevent fluid penetration. Goggles should fit snugly over and around eyes. Personal glasses are not a substitute for goggles. Face shields should cover the forehead and extend below the chin and wrap around the side of the face.
Use PPE to protect the mucous membranes of the eyes, nose, and mouth during procedures and patient care activities that are likely to generate splashes or sprays of blood and/or body fluids.
Select masks, goggles, face shields, and combinations of each according to the need anticipated by the task performed. For all PPE use, there are 3 key points to remember. 1, always put on your PPE before you have any contact with the patient. In most cases, this is before you enter the room. 2, after completion of tasks, but prior to leaving the work area, carefully remove and discard in an appropriate receptacle. 3, immediately perform hand hygiene. Those nice people that made those other videos about hand hygiene made a couple more that go into the details of putting on and taking off the PPE.
The second component of standard precautions is personal protective equipment, or PPE. This term refers to wearable equipment that is intended to protect healthcare professionals from exposure to or contact with infectious agents. Examples of appropriate use of PPE include use of a gown to protect skin and clothing during procedures or activities where contact with blood or body fluids is anticipated. Use of mouth, nose, and eye protection during procedures that are likely to generate splashes or sprays of blood or other body fluids. Use of gloves in situations involving possible contact with blood or body fluids, mucous membranes, non-intact skin, or potentially infectious material. All PPE should be safely removed to prevent contaminating your clothing, skin, or mucous membranes with potentially infectious material. Remove all PPE before exiting the patient care area, such as a cubicle or exam room, in the following sequence. Gloves first. Using a gloved hand, grasp the palm area of the other gloved hand and peel off the first glove. Hold that first glove in the other gloved hand. Slide the fingers of your ungloved hand under the remaining glove at the wrist and peel off the second glove over the first. Discard both gloves. Then remove your goggles or face shield if worn. Remove from the back by lifting the headband or earpieces and discard. Next, remove your gown. Unfasten the gown ties. Pull the gown away from your neck and shoulders. Be sure to only touch the inside of the gown. Turn the gown inside out, fold or roll into a bundle, and discard. Then remove your mask. Grasp the bottom ties or elastics, then the ones at the top, and remove without touching the front of the mask. Discard the mask. And finally, wash your hands or use an alcohol-based hand rub immediately after removing PPE.
And we're back. 3 more quick points. PPE is available to protect you from exposure to infectious agents in the healthcare workplace.
Know what type of PPE is necessary for the duties you perform and use it correctly.
And remember, PPE must be removed correctly to protect you from contamination. Well, that's about it for PPE.
So now that you know all about hand hygiene and PPE, you need to make sure these policies are implemented in the workplace.
You should provide training for every employee when you hire them, and at least annually.
Make sure your employees demonstrate the proper technique after each training session. Document all training and competencies.
Periodically monitor and document adherence to hand hygiene and PPE practice. Be sure to provide feedback to all healthcare personnel regarding their performance with hand hygiene and PPE use.
In short, you have to monitor that they take the training in the first place, and then monitor and document that they continue to adhere to the training.
Well, that's about it for the basics of infection prevention.
Are we done?
Yes, we are. Now you can get back to work doing the job of helping people and saving lives, knowing that you are up to speed on the basic precautions to help prevent the spread of infections.
Remember to visit the website for all the details on the charts and graphs we showed here, plus a host of other useful information to help you keep your facility on the straight and narrow when it comes to infection prevention.
Thanks for watching, and remember, keep those hands clean.